Hello everyone, this is Dr. Deepanshi and I am back again with a very interesting case in which we can learn so much about the medicines, about the medications and the diagnosis and the blood values. So let's dive into the case. So a 3-year-old spayed female dog is presented to you for depression, lethargy, and a typical sign that is polyuria and polydipsia. The people who are not knowing polyuria and polydipsia, polyuria will be lot of urine is there, lot of urination, frequent urination will be there, and polydipsia is frequent thirst is there, lot of drinking of water and lot of urination, that is polyuria, increased urine and increased thirst. So by seeing these signs we cannot know much about diagnosis, so we will do a blood test. Now, the blood test report has came in which the PCV is 48%, calcium is 19.32 mg per deciliter and phosphorus is 7.73 mg per deciliter. When you compare these values, especially I'll say, I have not put the normal values here and you can compare with the normal calcium values, which I am not going to tell it here. So we can see calcium in this case is seem to be elevated. Okay, in this case the calcium is elevated from the normal values. Calcium is 19.32 mg per deciliter. I am not told the normal values, you can check it up how much calcium is the normal value. And then now this is a case of hypercalcemia because calcium is elevated. Now our all the further questions will be in and around hypercalcemia and hypocalcemia. Okay, so moving on to the first question, that will be what differential diagnosis for this dog hypercalcemia will include except. Now in these we will go one by one and we will cancel out and we will see which one goes with the hypercalcemia and why it goes with the hypercalcemia. We will do the reasoning and we will find out the answer. Now coming on to the vitamin D toxicosis. Vitamin D toxicosis is if someone is supplemented with vitamin D supplements and lot of vitamin D if you are giving, then definitely hypercalcemia, elevated calcium levels will be there and vitamin D toxicosis will produce hypercalcemia. So this we can take as a differential diagnosis, it leads to hypercalcemia. Then hypercalcemia of malignancy. Malignancy is whenever malignancy, cancer cases will be there. In cancer cases, the calcitrol hormone always will be in the elevated form because of the hypertrophy of the cells. So in hypercalcemia of malignancy, as you can see, calcium, hypercalcemia, obviously in the sentence it's there. So malignant conditions also will lead to hypercalcemia. Now coming on to the C option, that is ethylene glycol intoxication. Whenever you get a case, ethylene glycol mostly will use in cars, and sometimes when in garage the cats will be there or dogs will be there, we will see a poisoning case of ethylene glycol intoxication. The phenomena that goes with this is ethylene glycol intoxication will occur. This ethylene glycol will produce oxalic acid into the body and this oxalic acid will bind with the calcium in the body and will produce oxalate crystals. Since now oxalic acid is binding with the calcium of the body, calcium is getting bounded, so means calcium will get reduced in the body. This will be the case of hypocalcemia. So we have found our answer that differential diagnosis of this dog hypercalcemia includes all except ethylene glycol intoxication. In ethylene glycol intoxication there will be hypocalcemia. Now severe hypothermia. In hypothermia case, what will happen? Blood viscosity will increase, density will increase. Okay, the blood temperature is decreasing, viscosity will increase. So deep hypothermia will also affect the myocardial contractility dysfunction. Myocardial means heart has to do a lot of work to keep the body in normal temperature. Okay, it has to do more work, and we always know that myocardial contraction is affected by calcium ion. Okay, many of you have guessed that, so very good. So more and more calcium will be used, more and more calcium will be used, so it will cause calcium overload. So this also will be a case of hypercalcemia. Now primary hyperparathyroidism. Okay, whenever we think about parathyroid hormone, we always think that it will be causing hypocalcemia, but no, the thing is, whenever hyperparathyroid hormone is activated and a hyperparathyroidism is there, there will be a case of hypercalcemia. So in all these options except ethylene intoxication, ethylene glycol intoxication, all will be a case of hypercalcemia. Okay, so moving on to the next question, that is, what will be the appropriate fluid therapy consist of all except. So we have seen that calcium levels are elevated, so we have to find a fluid therapy which will cause calcium excretion, okay, because hypercalcemia is there. Now one by one we will go through the options and we will cancel out and we will see which one goes with which and why. Okay, first is the fluid diuresis with normal saline. Okay, this will be a very good option. It improves the intravascular calcium and causes the excretion of the extracellular calcium. It promotes the serum calcium. It decreases the serum calcium in the blood, okay, by providing the diuresis. Diuresis means excretion, increasing more excretion. More excretion is through urine, the calcium is removed from the body. So this is a very good option, diuresis with normal saline. Now coming on to the furosemide. Furosemide, we should know, it's a loop diuretic. Diuretic you must have heard in pharmacology. It's a very important question. Furosemide, mostly teachers will keep it. Furosemide is a loop diuretic and it will increase the calcium excretion. Okay, it causes diuresis. Again, it will cause the calcium excretion from the body. This is also a very good option. Now coming on to hydrochlorothiazide. Whenever a word thiazide is there, this is a diuretic. Okay, thiazide is a diuretic. We should always remember thiazide is a diuretic, but its function is it leads to the reabsorption of calcium. Okay, it leads to reabsorption of calcium. So in these options, only one option, that is hydrochlorothiazide, will leads to reabsorption of the calcium, which leads to increase of calcium, which we do not want. We want its excretion, right, so that hypercalcemia can be managed. Now coming on to the prednisolone. Prednisolone, as we know, it is a corticosteroid. It will decrease the production of calcitriol, okay, which reduces the absorption of calcitriol. It reduces the absorption of calcium. Okay, so these three, whenever hypercalcemia case is there, we can manage through these three, that is A, B and D. These three we can do to manage a hypercalcemia case. Now coming on to the third question, that is, it's a very important question and we can get many things through this. Is there a concern for tissue mineralization? Okay, tissue mineralization and renal damage has started or not? Okay, mostly we depend on BUN and creatinine value, but this also is a very good calculation which we can see. What we will do is we will multiply calcium and phosphorus value and we'll get a product. Okay, if that product is greater than 70, in this case, if we multiply this value, what we saw, 19.32 and 7.73, if we multiply this, we will get a greater value which will be higher than 70, and so it indicates higher than 70. It indicates that tissue mineralization is occurring and renal damage is occurring, and it is a high chance that it can occur. Renal damage can further occur. Then coming on to the fourth question, many people have asked me this, that what is the mechanism of polyuria and polydipsia. So it can occur through these three mechanisms. We will see all. Okay, first is direct stimulation of the thirst center, through which also polydipsia will occur. More and more thirst will increase. Second, interference with ADH hormone. ADH hormone, what this hormone will do, it increases the absorption of the water and all the salts, but interference is there in the collecting tubule, So ADH is not working properly, so definitely the if interference with ADH hormone is there, definitely ADH is not working properly, so absorption of the fluids are not properly, so obviously polydipsia will there, more fluid is going out and animal will get thirsty again, and so polydipsia will be there. And obviously third point, that is tubulo-interstitial injury. Any injury, tubulo collecting tubules in cells, injury is there, the cells are not working properly, absorption is not proper, again it will, without any absorption, the urine will go as it is and frequently, and again polydipsia will occur. So these three are the important mechanism through which polyuria and polydipsia will occur. So I thank you all for watching my videos, and keep treating animals with all the love and all the knowledge you are having. Do not hide back for without treating animals, okay? And don't just randomly treat animals with antibiotics and giving a lot of steroids. Go to the basics, understand why things are happening and how we can treat them better. So keep loving animals, and please like, share and subscribe if you want more such type of videos. Thanks for watching. Bye bye.